Oh, wait. Hello, and welcome to the Viva La Vulva podcast. I am your host, Dr. Kara Quant, and I'd like to thank you for joining me today on this episode. Today, I have a special guest, a friend, and I guess you could say colleague of mine. Her name is Dr. Rhoda Moise. Moise? Dr. Rhoda, I want to say your last name right. Moise.
Moise.
Moise. And I want her in this episode. We're going to talk all about her research in cervical cancer screening and cervical cancer amongst Haitian women, which I feel is a great topic. And I feel like cervical cancer screening is a huge problem just amongst like African people of African descent, women of African descent. And so I am so happy that you did this research and just giving you a little bit of background. So Dr. Rhoda and I met on our journey to Kemet or Egypt. We were in the Sacred Woman crew with Queen Afua. And so I remember actually when we met, it was like near one of the pyramids. And I remember us getting off the bus and like waiting in line. And I just like started talking to you and, kind of seeing what you did. And you said, I work around women's health. And I was like, I work around women's health. And about your research, and so I was like, this is great to meet other people like you who are doing great things in the world. So I thank you for being on the podcast today.
Yeah, thanks. Thanks for the opportunity.
Yes. Wanted you to introduce yourself, just kind of what you do, where you're from, and how you got started in this research on cervical cancer amongst Haitian women.
Most definitely. Well, thank you so much again for having me on the podcast. Definitely cherish our memories in Kemet in Egypt. Amazing to connect with you doing women's wellness work, merging science and art. And that's exactly, in essence, what I do. So I was born and raised in the Philadelphia area. My parents are from Haiti. And growing up, I just noted the chronic diseases that impacted my family, from diabetes to different types of cancers to high blood pressure. And so that really inspired me to learn more about it. And so early on, I enrolled in like science summer camps, nerd life for real, and then also
Dim
continued.
life, right?
Yes,
Yes.
exactly. And so with that, my parents really instilled education and community in me from a very early age. And so I carried that into my academic interests, where I earned my bachelor's of science in biobehavioral health. And essentially, it's public health, the interdisciplinary examination of health and wellness. And through that, I had research opportunities, not only here in Philadelphia, where I was born and raised with the Haitian population, but also research in Thailand as well as Senegal, West Africa, looking at chronic disease prevention and control. So that brought me further to really look into how can we prevent cancer and chronic diseases, particularly in African ancestry groups, because of the health inequities that are present. And that brought me to Miami, University of Miami, where the Miami area is the largest enclave of Haitians living in the United States. So it brought me a bit closer to my roots. And I came into cervical cancer work relatively serendipitously. I initially started with diabetes because it was more familiar to me. So in that space, I read The Immortal Life of Henrietta Lacks by Rebecca Skloot, and that talked about the HeLa cell. Speaking of STEM research, HeLa cells come from Henrietta Lacks, a woman who died in the 1950s of cervical cancer, and her cells were taken from her from Johns Hopkins University without her consent, and even just more recently, her family are just really getting some type of health justice around that situation. And the context is HeLa cells are immortal, and what that means is they replicate um, without any type of manipulation, and that's useful for science because we can use that in research to be able to run studies. And so HeLa cells have contributed to the polio vaccine, to so many things and innovations in science. And so that's really what started to shift my lens and come to me as something to explore further with cervical cancer. And also, cervical cancer also, unfortunately, does affect the Haitian population um, in ways that we can do something about. So, with that understanding, I started exploring it more in my dissertation research through the lens of interdisciplinary elements, including quantitative, so the numbers, what is the data telling us? Then also looked at it through geographics and understanding where women who are potentially at risk for cervical cancer lived in Miami. So then we could have more place-based intervention to make sure that we're serving the communities that really could benefit, right? And then the third part of my dissertation was qualitative in nature. And so that part actually included data collection through interviews and photographs using Photovoice, a community-based participatory research method that engages the community to share their own narratives. And so women were consented in Haiti, trained to use digital cameras and take pictures of what they described as their barriers to accessing gynecological care, particularly screening. So again, the quantitative, the geospatial, the visual, and the qualitative um, came together for my dissertation to really look at these sociocultural and environmental barriers to cervical cancer prevention.
Hey. So what did you find as some barriers to cervical cancer screening? And before I get to that, so just for all of you out there that don't know the ways that we prevent cervical cancer, one is doing the HPV vaccine, which is fairly new in the last several years. We came up with the HPV vaccine, which helps to prevent the most common viruses that cause cervical cancer. And then the other one is the pap smear. And actually, I just had a episode on pap smears and just like the steps for a pap smear for anyone out there who has never had a pap smear before or who has refused pap smears in the past because they were nervous or scared or just didn't have a lot of education in it. So if you don't know about pap smears, go to the episode and listen to things about pap smears. But that is another way that we prevent cervical cancer, at least detect cervical cancer, is through, not prevent, but detect cervical cancer through the pap smear.
Yes, very important, the educational aspect. And so what I found, I want to structure it with sort of um, the view that I came with. Um, I looked at screening particularly, so not the vaccine, because of the scope of the study. And so the quantitative part, so I had looked at data that my mentor had at the time that included Haitian women. And it was hard to even get that level of data. A lot of the publicly available data sets, such as from the census, doesn't specify ethnicity. It might specify foreign-born status, but that's so vast, especially in a place like Miami where you have Caribbean immigrants, you have African immigrants, and you also have African Americans who are living in that area. So fortunately, I had access to the data that specifically looked at Haitian women, and the quantitative part used machine learning. Think about like when you're shopping, especially now, and you see it on the side, customers who bought these shoes also liked this. And so it's this algorithm that is able to put together pretty robust models for prediction. And I was predicting risk. So a woman who's reported that she's never been screened ever. And what I found there, it was that women who were younger, women who immigrated to the United States in 5 years or less, so recent immigrants, right?
And less from your research.
No, so they moved into the United States. They were there for no longer than 5 years.
Oh, okay.
So they just moved within the last 5 years of the timeline. So, they're still adjusting to the U.S. systems, etc. And then also women who reported that they didn't have citizenship. They were the ones who most likely to report that they've never been screened for cervical cancer. And so the implications there are so rich, right? Our younger recent immigrants who don't have access to citizenship are falling through the cracks in ways where prevention could simply be having access to screening to be able to detect perhaps early stages of cervical cancer, which are completely treatable, versus waiting longer and then it gets more complicated, right? So it really, the first part of my dissertation, the quantitative part, really had implications for immigrant health and how we approach that to help immigrants really navigate the U.S. system and integrate into and have access to the resources here, right? So then the second part, the geospatial part, visualized where these women lived in South Florida. And so it was very interesting that there were definitely women in Little Haiti, which is a neighborhood in Miami that is really referenced as where Haitians land when they first come to the United States, particularly within the South Florida region. But it also highlighted that that's not the only place that these women live. So when developing, whether it's interventions or programming, it's important to make sure that we're not just sort of limiting our scope to like certain neighborhoods, because that doesn't encompass the entirety of the population. And something also a nuance there is that there's incredible amounts of gentrification taking place in Miami and specifically Little Haiti. And so what does that mean? Where are these women going and how does that impact their access to health and healthcare, right?
Yeah.
So it's happening in a lot of American cities that, displacement of particularly of people of African ancestry is taking place in unprecedented amounts. So we really have to be conscious of how that, affects our health, right?
Yeah, I mean, it's happening in Inglewood right now with like the building of the stadium and the Ram Stadium, and just more building in Inglewood, which is predominantly a Black and brown community, but people are moving out pretty quickly because the prices are going up, and there's new development that's happening there. So the people who can't afford it, yes, where are they going?
Exactly. So that brings into to view another conversation that's really important. So those two studies were in Miami, and then the third part was qualitative, and that was actually in Haiti. So it was really a labor of love because of the timing. There's a lot of political turmoil that continues to take place in Haiti, and to even be able to do the study, it was just divine covering is the only way I could put it. I took multiple trips. None of the trips were longer than 2 weeks because of just the way life was moving at the time. I really wanted to have a experience where I was immersed in the area. I was in Semac, which is in the Central Plateau of Haiti. But we still give thanks because it was still a very informative and enriching opportunity. And so Photovoice, again, is a research tool that engages communities to share their narratives rather than the researcher sort of implying like, this is maybe what you think.
Yeah.
Right. So there were 25 women who were enrolled in the study. They were none of them have ever used a digital camera. So it was really cool to bring in technology and really encourage their artistry.
Yeah.
So they were trained on how to, like, simple functions of a point and shoot digital camera. And the prompt was essentially, try to capture anything that represents a barrier to you getting access to screening, to being able to have this preventative element for your health and healthcare. And so women were given about 5 days to take 5 images, then invited back individually to share what their experience was and, like, talk about the images. And then from there, images were selected and compiled to have focus group discussions to really unpack the images some more and to also triangulate the data. So basically to make sure that what I got from the individual interviews, along with a research collaborator who was based in the local environment as a midwife and nurse. And that was really important because although I'm of Haitian descent, I don't live there, right? And there's certain things that I am still disconnected to that being in this collaborative community environment and approach really was powerful for the analysis. And so from there, we have focus group interviews where we had more discussion on what exactly was going on. And so what we found there in the images are just so powerful because pictures are worth 1,000 words, as they say. And so one of the images were just a picture of a speculum, those big whole duck lips.
Yeah.
And it was powerful, just even the words that came to be the captions of the images, which were quotes from the women. Women talked about not really being familiar with what that tool was. Like, that thing is going inside of me. Like, how does this happen? Women also were concerned about sort of the sanitary elements. Like, is this properly cleaned?
Yeah.
So that it doesn't invite other diseases, right?
Yeah.
And that's really grand perspective in a resource limited setting where perhaps in the US, for instance, that's not something that's necessarily on our radar.
Yeah. Interesting. I mean, because from my perspective, or in the clinic that I work at, we're using plastic speculum. So we're throwing away, we're using a new speculum for each person. But there are the metal speculums, which are generally like autoclaved and cleaned, like with a machine, for places that either can't get the plastic speculums or what have you. But that's interesting.
Yeah.
They're I mean, I would understand that. Yeah, like, how is this cleaned? Is it cleaned properly? This is going inside of me. Is it going to hurt? Like, these are all questions that I would probably have as well.
Right. So the images like bring it closer to that human connection. So it makes it just like pretty straightforward in the ways of communicating what barriers are. So then we can start to also think about, all right, how do we overcome these barriers? And that's what one of the powers of Photovoice includes, is that it's not only identifying the barrier, for instance, but also encouraging the women to share what their approaches to overcoming the barrier would be.
So they're essentially giving the answer of the question that you're asking, of like, how can we overcome these barriers?
Exactly. And so that was one of so each image that we went through that conversation as well. So it wasn't just sort of the vibration of, oh, this is what's wrong, this is what's wrong, this is what's wrong, this is what's wrong.
Yeah.
There's information and power in that. But then, all right, then what do we do? Because it's equally important to have them contribute to that conversation rather than like they share the barrier and I'm like, okay, well, this is what you should do.
Yeah.
Like, listen to women, listen to Black women. They know very much, of their situations and ways to approach it and overcome it, right? So,
Yeah.
that work has been also, in speaking of merging science and art, has been in exhibitions, to be able to share these visuals of health importance. So really looking forward to continuing to sort of, share like what's going on, start conversations so we can really, really be intentional about how we move forward.
Yeah. Well, I have so many questions right now. Like besides I want to know about more of the pictures. Like what other pictures did these women um yeah, what pictures did they choose to show, and like what did they talk about like in their experience of the picture?
Absolutely. So there's like a scientific formula in essence to help organize the images. And so there were different categories that came up. And so discomfort was one, and the speculum was grouped under that.
Mm.
Another one was quality of care. And an image that they shared there, it was really telling of, um, there was a group of women, at least 5 women, and about like 2 nurses, healthcare providers. And you see in the image, like the vials of blood. So there's blood work happening or results or something, right? And so that's what the basic visual is. And then in conversation with the focus groups, it came out that because of the limitations in resources, there's sometimes group consultations. And so there are
Mhm.
spaces where your health information is shared in a communal way,
Yeah.
right? And with things that are, sensitive information, that came up as an issue. Women didn't necessarily want to have those group consultations. Um, they didn't want other people knowing that, you know, they went for this test and this is what the result was, etc. Because you got to think about it. You're in a, a community, people know each other,
Yeah.
right? And so this is also something else that wouldn't necessarily be on like my radar as someone who grew up in the West, with HIPAA and how we approach healthcare.
Yeah.
That group consultations would even be a thing.
Yeah, I mean, confidentiality is such a big thing. I mean, we sign as doctors confidentiality agreements that we're not going to share information. The nurses do the same thing. I mean, even for like some minors, like if they're over the age of, I think, 12 or 13, their information cannot be shared. So, if they're coming in for STD testing or they're coming in for, concern about pregnancy, we can't give that information to their parents. So yeah, that's a huge in confidentiality.
Exactly. And there was even like some resistance in that because um two elements. It was one from the participants, the women themselves, with them sort of understanding that there is sort of stress on the health infrastructure. And so being aware that, there may not be the time available or even like enough rooms or staff to be able to be seen one on one. So they understood that, but it's hard to accommodate um, for something that is so personal, right? So
Yeah.
there was the tension there. And then there was also the tension present with my collaborator because she's one of the people working at these health centers, right? And so she understands where they're coming from. But even on her essence, like she's like, I have like 80 people to see in a day. And if I go one by one, like there's no way I'm going to see everybody.
Gosh.
So it's just like the power of sort of being humble to sit back and let the conversation be guided by people who are living this experience and hearing more of what they are suggesting to be able to um, improve this. And so, for instance, again, I think it's really incredibly important to also share the solutions that come up. And
Yeah.
women had such like remarkable insight, like, duh, these are their lived lives. Let's
Yeah.
listen to them and let them guide. One of the things was to have perhaps um, decentralizing the health system so that there are like in community events where screening could take place, for instance, right? Um, Also, seasonal screening could take place. Like maybe it's not all year round, but certain parts of the year that also match up to um, the environmental aspects, because something that came up was travel and housing insecurity. And so when it's like rain season, and like people are traveling and it's hard to like even like physically access
Yeah.
somewhere, then perhaps we can take that into consideration of how we provide care.
Wow. I mean, yeah, that it makes sense. And like my mind is just like going right now. I'm like that I want to help. Like I want to be a part of, the solution, or like helping to do more cervical cancer screening, because it's easy. Like it is an easy thing, and it's an easy procedure. Not even a procedure. It's like it's just an easy thing to do, and quick. And I think, yeah, it does have a lot to do with like the doctor and making, or the provider, whoever is doing it, and making that person comfortable, and like this, giving them a little bit of education before actually doing the pap smear. Um, but yeah, no, my mind is racing. I'm like, I want to be a part of this change, and cervical cancer screening for women of African descent, because I was doing my research, and like there is the highest cervical cancer numbers are in Africa, or African descent women. So I think Swaziland is like the highest in terms of cervical cancer, and that's in South Africa. Malawi, which is also in Africa, like all of these places um, have a high rate of cervical cancer. And like you were saying earlier, it can be easily um, screened and easily treated if found.
Precisely,
Yeah,
precisely.
especially the early cancer, not the later stages of cancer.
Exactly. And so that really highlights the importance of getting screened and, like you said, getting screened early. And I think, like, of all the studies, the three, the quantitative, the geospatial, and the qualitative definitely was my favorite, because it was almost like a mini intervention in itself. Like going through the process of Photovoice, I noted that the women learned so much. Um, Part of that was like addressing fear with the exam, um, education with like how it takes place and the importance of getting screened early. And then another element was that women were empowered to not only get screened themselves, but also like share this information with people who were in their family group, with their community group,
Yeah,
to really promote health themselves.
yeah. Man. So like what is next? Like what's next? Cuz I feel like you opened up a whole can of worms, like I feel like you opened up this world almost, and yeah, so like what's next in terms of the research, or is there any next step?
Yes, great question. So there's twofold. One is um, addressing health, women's health in Haiti additionally. And so I'm currently looking at opportunities to have like educational programs to get this information out. Um, the global climate right now is not quite conducive to that. So, um, being patient yet still looking for opportunities to support this type of work, because even the women, not only the participants but my collaborator in Haiti is like, all right, like let's get into the schools, let's share like education for sexual health, um, with not only girls but boys too. Like let's get this conversation um, really continued throughout not only the country, but expanding this.
Yeah.
So I'm looking for again additional research funds to be able to expand the work and build upon it. Um, and then additionally, so a lot of my dissertation looked at the sort of environmental and social elements of barriers. And now I'm working as a postdoctoral associate in developing my skills as an integrative molecular epidemiologist to understand a bit more of the basic science of cervical cancer and HPV. So I actually just got a pilot grant awarded to look at that precisely. Thank you. So right now I am in the process of analyzing data from various countries. Basically, the premise is to look at the genetics and geography of HPV, human papillomavirus, as you mentioned before, the principal cause of cervical cancer. So the interest there is looking at people of African ancestry in New York. So that includes immigrants from the Caribbean and the continent. To also compare that data with various countries in the Caribbean and the continent of Africa to look at the differences in HPV strains. So going back to the conversation about vaccines, since I wasn't able to get that level of research in, I looked at more secondary prevention with screening, but with primary prevention with vaccines. The vaccine, even, there's two versions of it, the quadrivalent and the nanovalent, and that speaks to which strains of HPV that it's vaccinating against. And so there's high risk HPV, low risk HPV, and like a category of uncertainty. And so it's important to understand the distribution of HPV genotype because, say, for instance, there are certain areas or countries or populations that have a higher distribution, a higher incidence of a certain strain. And so that has implications on which vaccine might be best. You know, and in some of the countries that are included in the research study, they don't have the vaccine currently available. And so it's really have some of this information to be able to have implications for policy and procedures.
Hey, wow. My mind is blown right now. Like my mind is blown. I think that this is such a great thing that you are doing for the world, especially women of African descent, because we need it, and the numbers show that we need it, not only in Haiti, but like you were saying, other places. And so I'm just so grateful for you and wanting to take on this feat. Yeah.
Yeah,
it's big.
there's
It is
work
big.
too. So
Yeah.
the opportunity to continue doing the work.
Yeah. Well, I support you in any way. I mean, I would love to go to Haiti. I would love to go to other places and do some education or something, because I know, like I know just from the standpoint in the US, like sex education is lacking very much so. I mean, my education was, don't have sex, abstinence is the best thing until marriage, and like we know that that's not the case. We know that there's teenage pregnancy. We know that there's teenage STDs. STDs are very prominent within like the 18 to 24 age group. So like people are having sex out there, and so it's not just within the US, it's like outside of the US. So just providing kids and just people with this education is important. And also with cervical cancer and all of these other things that come along with having sex, being sexually active. Yeah.
So definitely so relevant. And it really comes down to being empowered to know and care about your decisions, right? To have the information to make informed decisions. So taking that into account, and then also while addressing like structural issues, I think that there's definitely a lot of moving parts, but we got to start somewhere.
We got to start somewhere. Yes. And you are definitely starting that journey. I also want to say that, so not only are you a scientist, with your PhD and you doing, getting grants and things, but you're also a poet. And so actually I had the great opportunity to hear some of Dr. Rowe's poem or poetry in Egypt. And I thought it was profound. Like I got goosebumps as you were saying it. And so I was like, can you please do a poem when you when you're on? And so if you can introduce the poem and maybe just give a little bit of background of why you wrote it, and then give us the poem because it's dope.
Absolutely, absolutely. So I really embrace my identity as not just a scientist, like you mentioned, but also an artist. And I think sometimes the science misses um, the soul of the work, right?
Yeah.
So that's exactly what poetry does for me. It's a channel, and I wrote this piece in reflection of womanhood, and it's entitled "My Womb is a War Zone."
Mm.
Let me sip my ginger drink.
Okay.
Clear the throat. My womb is a war zone. Crossfires of casual flings inflicting suffering. Sinister spirits overstaying their welcome. In my womb, they are warlords who refuse to cease, refuse to reach peace. In my womb, ways of the wicked won't allow for the wonders of womanhood to do well, blocked by energetic strongholds of ex-lovers, ex-others, ex-brothers needing to be exorcised. Lord, deliver me from this evil. My womb whispers their lies. You're not built for joy. You're fit to keep this pain. In my womb, there are ancestral abnormalities, warped realities, spiritual warfare. Yes, go there, know and care. I dare to end, no, I declare the end of this war in my womb. May these tidbits of terror be something I no longer consume. May there be a metaphorical white flag willing away this war zone in my womb because hate can't live here anymore. You're either whole and healed or carrying a war zone concealed. Do you feel? They say generational curses travel through bloodlines until someone is able to heal them. Well, I'm here to tell you it's time to feel them because then we can truly mend, my friend. May we be martyrs for our daughters and purple hearts for our sons, for our gender fluid babies. May we simply just come together as one and end this war zone. Ashe.
Ashe. Still giving me chills. Wow.
Thanks. It's a channel. It's a channel. So
It is a channel. Yeah. And like the what you said earlier about science and creativity, and I feel like sometimes they don't go together, or sometimes we learn not to put them together. And I think Viva La Vulva is my creative channel of like, okay, we talk about this left brain thing about anatomy and female sexual health, but there's another part. There's a creative part, the art part, the poetic part, there's so many other parts to it. And so I think it was birthed out of me. Viva La Vulva was birthed out of me in order to satisfy my creative side. And so I love that, I meet other people like you who are scientists, but who still find the importance of the other aspects, the creative aspects.
Absolutely. And I mean, when we met in Kemet, it was just confirmation that, like, yes, this can be done, So thank you for sharing and doing the work yourself as well.
Thank you. Well, thank you, Dr. Rhoda, for being on, for talking about your super important research on cervical cancer, on being dope and being a poet and sharing your poem with us. I appreciate you and wanted to see if you wanted to tell the people listening how they can stay in contact with you if you want that to be the case.
Absolutely. So you can find me on social media, including Twitter at Rhoda Moise. That's RHODA, M as in Michael, OISE. Also on Instagram as Dr. Romo. So that's at DRRHOMO. And we can definitely connect that way. Thank you so much. And looking forward to continuing the conversation.
Yeah. So if you want to continue the conversation with Dr. Rhoda, hit her up on those socials. I will put it in the description so you'll be able to see it if you didn't catch it. And with that being said, again, thank you, Dr. Rhoda, for being on. And thank you for everyone in listening to the podcast. If you enjoy what you're listening to, please subscribe to the podcast, subscribe to the YouTube channel, tell other friends and family about it, and that would be great. But with that being said, have a good one. Bye.
Peace and blessings.